evidence, and clarity, to champion stewardship in our schools, hospitals, and communities, support innovation and responsible access to antimicrobials, to advocate for sustainable diagnostics, surveillance, sanitation, and equitable health systems, then to hold ourselves and other institutions accountable. Leadership is not just about the title we possess, but it's the responsibility that comes along with it. So today, each of us promises to become responsible for securing the future of antimicrobials for the next generation, so that when the story of AMR is told from generations from now, they will speak of the Koches, the Flemings, the Floris, the Chin, and the Waxman, but for us, they will say that we were the ones who protected antibiotics. So in as much as they discovered antibiotics, we must defend them. What they built, we must sustain. And what they warned us about years back, we must confront them now. So if Fleming gave us penicillin, we must be the generation that preserves its power. And if Waxman gave us antibiotics, we must still make sure that it works for our children. And if Koch laid the foundation for infectious disease sciences, we must strengthen surveillance and AMR prevention across Africa. Like I keep saying, we are not mainly students or young professionals, but we are the next custodians of global health. So I hope this is not just a 3-day event we all attended, but the beginning of a movement we will sustain. So let our youth commitments become action, and let our voices shape policy wherever we find ourselves. And let our expertise in various fields, being pharmacy, public health, microbiology, guide the next era of AMR responses. Because the world is watching us, Africa is watching us, our patients are also waiting, and history will definitely listen. So tonight we will say that we will advocate, we will educate, we will optimize, we will innovate, we will protect, and we are committed to this action. So to end, our pioneers discovered antibiotics, but our generation must be the one to save it. And this is our moment and our responsibility to secure the future for the next generation. So thank you all, and let's begin work in protecting our antibiotics. Thank you.
Thank you, Dr. Buku. Please, we'll start with the questions and answers. If you have any question, please type in the chat box or raise your hands. If you have any question, please type in the chat box or raise your hand. Hello, please, any question? All understood. I'm hoping we all learned one or two things and we would go and spread the news of antimicrobial resistance and create an awareness to it. Thank you, Dr. Buku, once again.
Yeah, thank you.
Thank you, Shalom, for that, and thank you to Dr. Derek for that impactful closing ceremony speech. I hope you've gotten a thing or two from it. As we await the next speaker, we can be typing in the chat what was your best session during this AMR forum. Israel, are you there?
Yeah, I'm there.
Yeah, you can translate.
Oh, ok. Donc, vous pouvez écrire dans le chat box quelle a été votre meilleure session depuis le début. Quelle a été votre meilleure panel, vous voulez dire? C'était la cérémonie de fin, 3 jours. Et c'est la dernière cérémonie de clôture. On a invité le docteur qui a parlé de manière générale sur la résistance antimicrobienne, sollicitant les jeunes à s'y engager. Donc, on est à la fin. Quelqu'un a demandé si vous aurez les certificats. Oui, non, moi j'aurai les certificats. Susan, someone just asked in the chat box if they will get the certificate.
Yes, so send a post-evaluation survey and we'll be able to get your certificate after that.
OK. Donc, il y aura une fiche, c'est juste pour vous évaluer. Vous devez répondre. Juste après, ça, il y aura un certificat qui sera délivré à tout le monde. Merci.
Yeah, yeah. No, I don't ask for it right now. I don't know. My connection is a little bit difficult here, but I had one question to ask. Are you listening to me?
Yes, we can hear you.
My name is Joseph Otto. So I've a really question. I had many questions, but I'm going just to ask one question now instead of waiting for the next speaker. So my question was talking about.
You're breaking.
Do you catch me?
I can't hear you well.
Yeah, so my question is to know in the public health, what are ways that you can use, normally speaking, to stop or to cap that process of using antibiotics or antimicrobial antibiotics, randomly, because in our community, especially in Africa, people always use badly antibiotics. So I want to know what are ways that speakers or professional of health as puts in order to make to make spread the information to the population and to help them to know how to use antibiotics in order to avoid the antimicrobial resistance.
Hello, Joseph, please, is that the end of the question?
Hello?
Yeah, please, are you done with your question?
Yeah, I'm done. I'm not.
Okay, please, Dr. Derek, over to you.
Um, I'm so sorry, but can you summarize the question for me again? It wasn't really quite audible.
I was also having network challenges, so I couldn't hear him clearly. Joseph, please, can you kindly um ask the question again?
Do you want me to write the question or to come back with the question?
Come back, please come back again.
Okay. So no matter. So I was talking about in a public F domain because we are in Africa community and people or population use badly antibiotics. So then it brings them to antimicrobial resistance. So I want to know what are ways that you can, propose to us health professional to tell to the population in order to avoid them to fall down in antimicrobial resistance. So I want just to know ways or solution that you can propose about how to curb that process.
All right,
Okay,
thank you. Rightly said. So for me, I'd like to use an example. So over the past few months, we've been having this flu running around parts of the country where everybody reports with a flu. And then when they go to the community pharmacy, the first thing they ask for is antibiotics. But then we all know that these flus are usually caused by viruses. So for me, I think one way we can limit the reckless use of antibiotics is to promote health prevention. First of all, trying to prevent an infection from occurring. So even taking the flu, for example, you could do other things. You could do steam inhalation. You could do vitamin C with zinc. I mean, there are other ways of preventing. Let's not make antibiotics the first line for everything, right? And one other thing too is serving antibiotics without prescriptions. At least let's see a valid prescription. Because like we said, somebody with a resistance bag, somebody you give antibiotics for and gets a resistance bag, you may think it wouldn't bother you, but it may go around and come back to you because you will share that infection with somebody else and it will come back to you. So in safeguarding antibiotics, first of all, we want to practice health prevention, the simplest thing. During the time of COVID, with the face masks and social distancing and covering our mouths doing coughs, we realized that we were reporting a lot of common colds during that period, although the COVID was going on, because we were practicing safe measures and then health prevention protocols. But COVID is gone, and then we've been quite lax. Now, if we are wearing those masks, we are seen as the a strange person. But we still have to practice some form of health prevention. So, and first of all, if we have to give antibiotics, at least let it be with a prescription. Then let's all practice safe measures from getting infections. Thank you.
Thank you, Dr. Derek. Israel, if you're on the call, please can you translate it to French for us?
Sharon, yes, I was on the call, but unfortunately, I didn't get it because it was breaking here, my network.
Okay.
Yeah, unfortunately. Yeah.
Okay. Okay. Thank you. So please, on to our next speaker. We have Dr. Obed K.O. Amponsa on the call. So Dr.
Hello.
K.O. Amponsa, pardon. So Dr. K.O. Amponsa is a member of the Pioneer Doctor of Pharmacy class in Ghana. He has a PhD in clinical pharmacy with a focus on antimicrobial stewardship, infection prevention and control. He's also the co-lead of the antimicrobial stewardship program at the University Hospital of KNUST, Ghana, in addition to consulting nationally on stewardship and related areas. He has conducted and published research in the subject area and is passionate about personal development and mentorship. So please, in the chat box, once again, let's clap for Dr. Obed K.O. Amponsa. Over to you, Dr. K.O.
Okay, can you let me just be to French since we still have our French people here. So,
Okay.
donc, salut à tout le monde. Veuillez recevoir Dr. Obed K.O. C'est un pharmacien au Ghana et il a fait le PhD en prévention des infections et l'université, donc à l'université de KNUST, Ghana. Il a conduit beaucoup de recherches et c'est un passionné du développement personnel. Est-ce que vous pouvez acclamer pour Dr. Obed K.O.?
Okay, thank you, Israel. So over to you, Dr. K.O. Amponsa.
Yeah, excuse me, as we wait for the speaker, can I talk?
Dr. Obed K.O., yeah, you have the floor.
No. Hello, can you hear me?
Shalom. Dr. Obed K.O.
Sorry about that. He's having some technical issues, so he's trying to resolve it, and he'll be on the call.
Oh, all right. Donc, le docteur, actuellement, il est en train de voir un problème technique, un problème de réseau. Il est en train d'essayer de nous joindre. Donc, un peu de patience pour que, avant qu'il...
Hello, I have one contribution, if you allow me. The room is silent here.
Okay.
Good. I would like just to say, I think regarding to the previous question asked by Joseph, just want to say that we should recognize that some of our country have financial issues, and I think nutrition is also important when it's come to health issue. that when the person actually is, maybe we are talking too much here about flu or common cold, that person, we should ensure that at least he is able to eat, he has something to eat. As a young, he may not have something to support them. But if you can ensure that this person is eating well, and then this when you eat well, in case you have medication you can take. So that is very important as well when it's come to therapy. Nothing is magic. So this poverty, our government should also work. Those in leadership positions should also work to reduce it. I come to prevention method as the speaker said. When you are wearing face masks this time around, you are a stranger. That's what happened to me in my station where people are having flu, and when I wear face masks, I'm the most strangest people among them. But anyway, that doesn't discourage me. I keep wearing my face mask, and then when it goes, I become a normal person. So not easy. The environment is not also easy as well. And that's Africa. We should be resilient. Thank you.
Non, donc du coup, il y avait il y avait il y avait un participant qui avait posé une question. Je suis calé parce que ça coupait. Pour répondre, il avait répondu à la question, il a encore donné une clarification. Et par rapport à ce qu'il a répondu, c'est que nous devons aussi reconnaître, admettre que voilà, la plupart des pays africains n'ont pas trop d'argent. Il y a un vie économique qui est là. Donc, la nutrition, ça joue beaucoup de rôle. La plupart des trucs que nous mangeons, vous savez, une malnutrition diminue le système immunitaire, donc c'est un problème de santé donc, qui affaiblit beaucoup notre système immunitaire, donc affaiblit notre santé. Donc, il y a les techniques de prévention qui peuvent être mises en place. Et également la place de l'environnement qui joue aussi beaucoup de rôle dans la résistance antimicrobienne. Donc, en gros, une bonne nutrition veut dire on sera en bonne santé. Bonne santé va nous permettre d'avoir un système immunitaire solide pour résister aux bactéries tuées tout. Donc, voilà. Je n'ai pas bien capté la question que Joseph a posée au début, malheureusement. Mais je trouve que ce qu'il a dit, ça a tout son sens quand même dans la résistance antimicrobienne. Merci beaucoup. On est toujours en train d'attendre le docteur Oubet. Ah, il n'est pas toujours là. On dit qu'il y a un souci technique à n'arrive pas à nous joindre.
Hello.
Hi, Shalom. Good
Okay.
evening, friends, guests, everybody. Please accept my humblest apologies for the technical difficulties. It's a pleasure to be here, and I'd like to say hats off to Dr. Derek Buku for the great job that he has done. There isn't really much that I can add on, but I will try. So please pardon if I do not meet your expectations. But I'll try to add on to what Dr. Buku mentioned. So due to the technical challenges, Shalom mentioned that she has introduced me. I'm very passionate about tackling AMR in Africa, particularly in Ghana, where I am. The bulk of my work is focused as a researcher, as a clinical pharmacist as well as a teacher, more or less. And in all of these areas that I am practicing or that I am working in, I have found that once the youth are well engaged, things move very quickly. So I've been involved in, for instance, supporting the training that the WHO is giving a number of facilities in the country on setting up antimicrobial stewardship, which we know is one of the key ways that we can one of the key interventions that we can put in place to tackle antimicrobial resistance in hospitals, in the community, across the board, right? And in all of these areas, once you go, it is the young people who are there who are taking charge of some of these programs, who are taking charge in making sure that, okay, it's not a program in name only, but in action. So it's a great opportunity that we all have here as young ambassadors of antimicrobial resistance, that we can really take the charge. And this is a great opportunity for us. So as Derek mentioned, the pioneers have discovered the medicines. It's up to us now to save them. That is the challenge that has been thrown to us, right? And if you look at how big of a problem we are facing in Africa, the burden of AMR in Africa, as well as the fact that by far we have the largest youth population in the world globally. Can you imagine the potential, the sheer potential, if we were to come together to tackle this problem from whatever angle that we can handle it from? And I say whatever angle that we can handle it from, because again, some of the problems that we are facing may not be huge problems. So for instance, there are huge problems like surveillance issues, right? Surveillance gaps, infrastructure. We don't have the infrastructure. A lot of places don't have the infrastructure to be able to be doing a lot of the surveillance on AMR, antimicrobial use, antimicrobial consumption that we need, okay, or that is available in the West. But fundamentally, our problems include awareness. People are not aware that there is this big problem. Now imagine, right? Imagine if the youth is leading some of these things. Look at TikTok, look at Snapchat, look at X. The bulk of the users are what population? The young population, right? Is it any surprise that all of these social media companies are setting up offices in African countries and all of that? No, it's because the market is here. Then we as pharmacists, and as IPSF AfRO, we have a great opportunity to leverage some of these things, right? Improving the awareness. Even in the universities that we are coming from, even in our workplaces, right? The issue of self-medication, the issue of inappropriate use, we can do something about it, can't we? Right? Again, even the World Health Organization has identified that we need the voice of the youth in tackling AMR. Okay, so you find that there's an AMR toolkit for youth engagement by what we call the quadripartite, which is 4 organizations involved in human health, animal health, food and agri, as well as the environmental health. Okay, coming together to tackle antimicrobial resistance, because it's a one health problem. We cannot win this fight on only one sphere. We can only win it if we are putting our efforts together, right? And all of these 4 major organizations that are representing all these 4 major One Health sectors have all identified that we need the youth. So can you take a look at that AMR toolkit for youth engagement? Take a look at it. Is there any way that you can adapt it to your setting? Is there any way that you can use it in the work that you do? Right? Then we would be really pushing the agenda forward. Right? Again, we know that we have very, very smart people. Okay. The most imaginative people in the world are young people. Okay. So case in point, we had a situation where, okay, we wanted to go to a basic school, right? And then try and improve, do an awareness creation exercise, trying to improve their awareness of AMR. But how do you break down such a complex subject in a manner that the students, those adolescents will understand? All right, we are talking about junior high school students. Really, really, like, I mean, really, really, kindly confirm you can still hear me.
Please, we can. Please go ahead.
Excellent. Very good. And please let me know when my time is up, okay?
Yes, please.
How do we break this down? All right. Of course, we had leadership commitments in terms of the team that we had put together to tackle this issue. All right. And we're doing it as part of an antimicrobial stewardship program at the University Hospital KNUST. And it was the young people on our team that we came together, came up with a storyline, and had one young pharmacist illustrate a comic book that we use to train these students or improve their awareness on AMR. And you know, after that, we interviewed a few of them. We just selected a few of them at random, and then just asked them what did they learn, and it was fantastic. These very young students, 12, 13-year-olds, and they are explaining AMR to you as if they have been fighting this whole problem for ages, because we had a youthful population, a youth-driven initiative that used this innovation of comics instead of just for entertainment, using it to educate, right? Myself, I am still part of the youth, right? Fortunately, I am part of the youth, and I am proud to say I currently co-lead the antimicrobial stewardship program at the University Hospital, right, with the director of the hospital, and it's been a fantastic job to do, because you get to see that once we put ourselves out there, once we are supporting the activities that need supporting, once we are, again, passionate about developing ourselves and putting ourselves there, the doors are open. All right. The older generation in quotes, are going to be more than happy to give us the opportunity to show off our talent, right? And one thing that I want to mention, I want everybody to take seriously, is mentorship. All right, find a mentor, find mentors, not just a mentor. Find mentors. I think, I don't know if it is the same across all the African countries, but here we don't talk to our seniors enough. I think we don't talk to our seniors enough. Find the mentors. Speak to those who have gone ahead of us. Okay, what would they do differently? Right? What do they do that worked well? And sometimes some of these things, it's just a matter of, for instance, just having a conversation with them, and you can just pick a few pointers from them. And again, your mentor doesn't have to be doing the same thing that you want to do, but can help you to find your way or find your feet. And sometimes you are you are, and I remember when I was fresh out of school, for instance, you are chock full of ideas, right? The fire is really strong. The fire is really hot, and you can do this. You have a lot of energy. You can do this. You can do that. You can do that. Sometimes when you have these mentors, they help you to focus your energy so that you can make the impact that we need to make, so that you can enter the leadership roles. You can go into policy. You can go into innovation. You can do whatever thing. And sometimes when you speak to some of these people, they can also help you to identify where the gaps are in your specific area that you are interested in. And then you can now also brainstorm ideas on how to get the things done. Right? Community engagement. Who has the energy to engage the communities that we live in? Right? So again, this is a great thing. This AMR, this youth forum, this can be a real movement that can drive some of the things that we want to see in AMR changes on the African continent. Because we face a high burden of AMR, right? We face a high burden of, and outside of this high burden of AMR, we are a low resource setting imposed by far. Most of the time, we are considered low resource. Okay, so the little that we have, we need to let it go a long way. You need to see that you on this call today, as well as your colleagues that you can mobilize, we are the resource. Okay, we imagine if we say across the continent, we are for instance next year's AMR week, we are doing a concerted AMR awareness program, right? Where we are doing, for instance, a social media engagement, and we decide that, for instance, maybe at 12 p.m. today, we are all sharing the same message across the board, across all the pharmacy schools in Africa, across all the among all the health workers, about early career pharmacists that are on the continent. Can you imagine the reach? Can you imagine it? It is some of these things that I want us to take away from this, and this is a great initiative from IPSF AfRO, that we can really move this forward, and it can even be bigger than this. I am really grateful that you have given me this opportunity to speak. Always, once we get the chance as young people, we need to educate people. We need to advocate for change. We need to advocate that, okay, if it's just a matter of saying, just finish your antibiotics. Okay, you don't need these antibiotics because this is not a bacterial infection, right? If you have an innovative idea, we need to bring it to the fore. We need to bring it to the table. And like I mentioned, find a good mentor. Find mentors. Speak to your seniors, all right? Speak to people. And then you can find the people that you resonate with, and you can align properly, and they can support your growth. AMR, again, as we are aware, it's not a problem of tomorrow. It's a problem of now. If we lose the fight against AMR, unfortunately, it is our lifetime that we are going to see the problem. It's actually our lifetime that we are now seeing the problem. So we need to really take this seriously as we are doing now, and keep moving forward. Thank you very much for this opportunity. I think I have ranted enough. So I'll hand it over back to Shalom to continue. Thanks, Enova.
Thank you, Dr. Obed. I hope everyone got one or two things from what he said. Over to you, Israel.
Ok, merci pour la parole accordée. Thank you for giving me the floor. So, donc, du coup, le docteur Obed a parlé de la résistance antimicrobienne. Il a parlé de la sensibilisation de manière générale. Il a dit que certains problèmes que nous sommes en train de rencontrer, les grands problèmes liés aux résistances antimicrobiennes, normalement en Afrique, ne devaient pas être le cas. Parce que vous le savez, en Afrique, il y a tellement de jeunes. L'Afrique est le continent qui regroupe plus de jeunes que beaucoup d'autres continents. Donc, à travers les jeunes sont les personnes qui peuvent lutter contre la résistance antimicrobienne. Pourquoi? Parce que les jeunes, dans le domaine de réseaux sociaux, on est toujours présent. Les TikTok, les différents réseaux sociaux, les Insta, tout ça, on est toujours présent. Donc, à travers nos différentes plateformes, et si nous décidons de lutter contre la résistance antimicrobienne, je pense que nous pouvons y arriver. Et pour pouvoir la sensibilisation, le fait que la résistance antimicrobienne tue, le fait de prendre les antibiotiques à moindre maladie, petite maladie, vous prenez les résistances antimicrobiennes, il faudrait qu'on en parle, il faudrait qu'on sensibilise les gens de notre quartier, les gens aux alentours, là où on travaille. Et il croit également que beaucoup d'entre vous, vous êtes assez intelligents, vous êtes plein d'énergie, et il croit également que si vous décidez pour faire des trucs, vous allez arriver. Mais la chose la plus importante, c'est un mentor. Un mentor qui sera là pour vous diriger lorsque vous avez besoin. En Afrique, il ne sait pas dans votre cas, mais là où il est, je pense, du Ghana, il dit qu'eux ne parlent pas assez des aînés, des mentors, que c'est un truc qui doit vraiment changer, qui doit plus parler mentors que des aînés, parce que eux, ils peuvent nous aider. Les erreurs qu'ils ont faites ou bien les stratégies qu'ils ont mis en place qui n'ont pas réussi, ils peuvent nous conseiller de faire autrement pour que ça marche, pour que ça réussisse. Il a même donné un exemple que chez eux là-bas, il y a une petite communauté où il y a les élèves, et pas les élèves et les jeunes de 12 ans, 13 ans, avec lesquels ils ont parlé de résistance antimicrobienne, ce qu'il faut ne pas faire, ce qu'il ne faut pas faire pour avoir résistance antimicrobienne. Et après, quand ils ont posé la question à ces jeunes-là, les jeunes ont tellement répondu qu'eux-mêmes étaient surpris. Les jeunes de 12 à 13 ans. Donc, cela démontre une fois de plus que nous ne devons pas minimiser les jeunes, la force des jeunes. Nous sommes la jeunesse. Il a dit également que ce prochain, par exemple, si tous les gens à la même période, dans le monde entier, les jeunes peuvent parler de la résistance antimicrobienne, est-ce que vous imaginez l'impact que ça aura sur tout un chacun? L'impact sera vraiment énorme. Donc, du coup, à travers la sensibilisation, à travers les réseaux sociaux, à travers notre force qui est la jeunesse, ils pensent vraiment que ce problème qui est un gros problème, si on prend vraiment conscience, ne serait rien du tout comme problème. Donc, voilà ce qu'il a dit. Je vous remercie.
Okay, thank you, Israel. Thank you so much. So please, if you have any question, please raise your hand or type in the chat box. Our speakers are here to answer your questions about antimicrobial awareness.
Ok, si vous avez des questions pour le qui a présenté, qui vient de dire. En tout cas, c'est une cérémonie de clôture. Donc, c'est juste pour parler de manière encore générale, de manière ramassée, tout ce qu'on a eu à voir, tous les panels qu'on a eu à voir. Donc, eux sont là juste pour, voilà. S'il y a des questions que tu n'as pas pu poser, vous pouvez poser, écrire dans le chat box. On va répondre. Dans le cas échéant, on s'approche de la fin comme ça.
So please, any question, any contribution, this is welcome.
Yeah, I have a question for Dr. Hobet. It's about communication for maybe assistant pharmacists or pharmacists over the counter. Like you are in the chemist, and then since you have heard about AMR, you have this patient, they have two scenarios. One scenario is that there is this patient who came, we suppose it is a he. He comes over the counter without ordinance and have a huge fever. And you may suspect an infection, and he will be telling you that I used to take this drug. It may be antibiotics, it may be antiparasite, and I get healed. I feel better. So let me have this drug in order to get better. This night, this is It's actually, let's say it is 11 p.m. in the night, and you have this patient in emergency without ordinance. Another scenario, you have the patient over the counter with ordinance, and this patient is having the same issue, a pharmacist, and then we need this medication in order to get better. And you know very well, perhaps this may not work for him. But since they are pharmacy, you want money, because we know it's also a shop. We have transformed our chemist in a shop in Africa. So you want to make money. So what will be advised? Your advice for this chemist over the counter who is looking for money, or donors is there and they want to sell the product, what the communication will be. Thank you.
Thank you, Fernand. Please, Dr. Obed.
Okay, so I was going in on and off because am I right? Let me try and summarize the question. So then you mentioned, okay, you have a scenario, you're in a pharmacy or in a chemist, patient comes to you, it's maybe 11 p.m. Person has a fever, and I think the person is insisting on an antibiotic, right?
Not necessarily antibiotic, maybe antiparasite, any antibiotic, depend on the infectious syndrome thing.
Yeah, okay. So again, you're asking what to do in that scenario.
What will be the communication in that scenario?
Yeah. So okay, so that is where your knowledge in clinical practice, or in terms of more or less understanding what the clinical scenario or condition of your patient is very important. So one thing that we have to make clear is that antibiotics are life-saving. The whole thing that we are making noise about AMR is not that we withhold antibiotics from our patients. The point is that we want to get to a point where if a patient needs antibiotic, the patient gets it. But if the patient doesn't need it, the patient doesn't get it. So I will throw this back at you that in that scenario, based on your evaluation, let's assume this patient is not giving you pressure. Even if this patient is giving you pressure, based on your professional judgment, will paracetamol or an antibiotic be okay till the morning? If so, then that is what you should do. However, if you have a high suspicion for that for an infectious um, condition, right? Then you are justified if the laws of your country allow it. So, for instance, in Ghana, without even though antibiotics are prescription-only medicines, pharmacists is allowed under the law to dispense or supply antibiotics to a patient if they believe the patient needs it, right? So if the law allows it, then I believe you can go ahead and do it. Otherwise, again, fever doesn't equal infection. So you look at what other symptoms does the patient bring, right? What other yes, what's the history of this patient and all of that, okay? And then you can make a decision. In a situation where, for instance, you come to the conclusion that this patient doesn't need the antimicrobial, what I like to do is, or and they are still insisting, what I like to do is tell them is that, look, I am here to take care of your health, but I'm also here, as it were, to make money, because these medicines here are not for free, right? If I believed you needed these things, I will sell it to you in a heartbeat. So if I am hesitating to sell this to you, you should understand that it is for your well-being. Okay. And it's because I strongly believe you do not need it. More often than not, it works. Right? Sometimes they are adamant about it, right? But they know, they think, explain to them, no. In this case, you know what I want you to do. Kindly try this alternative. Try this and this, because I believe this is this and that is what's happening. And then you come back today or tomorrow or the next, and let's see what happens. All right. You will agree with me that you didn't need the antibiotic that I'm saying you didn't need. If they still insist, again, you have to stand your ground again, because the chemist or the pharmacy is not like a supermarket, right? You are the expert. So if you believe they do not need it, you stand your ground and you do not give them, right? I always believe, again, in terms of the money aspect, we want customers for life, in terms of like return customers, so that they will come instead of that your boss is looking for. Because of course we can't take out the pressure that you get from your boss. If it's one that the boss is looking for, they are going to get it, in fact, a bigger amount long term than the short term antibiotic that you could have sold to this patient. Thanks and over.
Thank you, Dr. Obed. Ferdinand, I hope you are.
I'd like to find out if I can add on to what my co-presenter said.
Yes, sorry, go ahead.
Okay, so to add on, one thing I also like to say is that, so the patient comes in sick like that. I mean, for all of us, what we usually tend to give would probably be an oral antibiotic. But I'm sure from our teaching, our practice, and our experience, we realize that these patients rather benefit from a parenteral and IV anti-infective than an oral. And one thing I've come to realize is that once you treat that patient in the pharmacy, they wouldn't go to the hospital even if it's getting worse. They believe that since it was you in your lab coat who initiated that treatment, they will keep to it even if it's not improving. So for me, that's one of the reasons why I tend to not want to treat such patients in the community. Because when you give an intervention, they will decide not to go to the hospital even if it's getting worse. So if it's something that you think is beyond you, that's something that an oral could not do, it's best to explain to them that in as much as like you are here to make money, for their own sake, it's best to go to the hospital to get the appropriate treatment. And even when they are discharged and they have anything else to buy, they will definitely come to you because you give them good advice. So they'll always come back to you for anything else. So that's one way we can deal with such cases. Thank you.
Okay, thank you, Dr. Buku. Israel, please, are you on the call? Okay. Please, you also have another question in the chat box from Roosevelt. He's asking, so what if you have a patient who just from her mess? Okay, so what if you have a patient who just from her mess? I'm assuming that the person is saying menstruation, is demanding antibiotics to take. What should I do after knowing the effect of using antibiotics as a lady after your mess, but the patient keeps demanding for it? Roosevelt, I think the question has been answered some way, somehow, by Dr. Obed and Dr. Derek, but Dr. Obed, please, can you say something on this?
An additional thing in this particular case, you have a great opportunity. This patient is female, so and again, understand who your customers are, and then you can adapt your approach to them. So this is a female patient, and you know, again, the impact of antibiotic misuse on the gut flora as well as the vaginal flora, right? If you explain to them again, it is all about communication, right? Explain to them the impact that the antibiotic is going to have, not just on the resistance, but on the fact that it's going to kill your normal flora in the vagina and it's going to predispose this individual to getting candidiasis, right? And lots of the time they understand and will listen to you, okay? Then in that case, then you need to ask them, all right, why? What have they seen? Are they experiencing anything? They need to probe to really understand what is happening. Okay, sometimes you also need to understand some of the for lack of a better term, okay, yes, misconceptions. Okay, maybe somebody told them that once after your menses you need to take this, okay, because of this or that, right? So again, communication. Thanks and over.
Okay, thank you, Dr. Obed. Israel, please, are you on the call? If you're on the call, can you translate what you've done so far? If you're not on the call, over to Isaac Mutela. Isaac, you had a question.
Yeah, okay. Thank you for the floor. I have the question about the detecting of resistance mechanism. Awareness is the best solution. However, upstream there is also an issue of detection. Besides awareness, what my question is about, what is for the Dr. Obed, what do you think about detecting new resistance mechanism late? Early identification of emerging resistance is crucial as it helps guide timely and effective decision making. What strategy would you propose in this regard besides awareness? Thank you.
Okay, that's an excellent question. I'll attempt it. So when you talk about mechanisms of resistance, right? You're looking at biotechnology, molecular biology, okay, where you may not have the capacity in your facility or in your country or in your area, okay. Now, I like to always say that we use what you have, and then you can build on it as you go, okay. And another example that you can use to explain this is based on, suppose you are very hungry and you come up to a mango tree, right? A mango tree, and if you know mango trees, right? Every single time they are in season, there's always one at the very top that is ripe and very appealing. But you have also some down that are easily reachable to you that you can pluck relatively in a simpler way than the shiny one at the top, right? So the system now comes that, okay, what are you going to do? Are you going to use all your energy to try and pick stones and sticks to reach the one on the top, or you pluck the one that is close to you, the low hanging fruit, and eat, get the energy, and then move upwards, be able to climb the tree to the top to get the shiny one? It's always better to get the low hanging fruit, is it not? So it's the same thing. If the facility you do not have, and again, the molecular biology is very expensive. If you do not have it, and always we have our culture and sensitivity, then again, what we need to be doing is advocating that as much as possible, all patients that we need to do these cultures in, at least at the minimum, we are sending a sample for culture and sensitivity analysis before we start treatment, so that what we get at the end of a period is a cumulative antibiotic susceptibility report, which tells you that, okay, in this year or over this period, in our facility, all the patients that came, these are the bacteria or the organisms that we are isolating from them. And this is the antibiotics or antimicrobials that work well in these people. And then it can guide our empiric prescribing. Okay. Another thing that we could do, next steps, I think, is looking at rapid diagnostics. Okay. So there are rapid diagnostics that we can use for STI diagnosis. There are also these little rapid diagnostic test kits, these small boxes that measure C-reactive protein. Okay. And as you are aware, C-reactive protein is a great marker for for bacterial infections. If it's high, then you have a high suspicion for bacterial infections. And it's a small marker, a small test kit that is like your malaria test kit that we can use easily. So these are all things that we can sort of go look at to get ahead of it, right? But again, if we do not have the microbiology, the biotechnology to be doing the molecular biologies and all of those things. Whatever that we have, we start with it, and then we build on that from there. The most important thing is we are actually getting the information and utilizing it. I hope I have at least said something useful to you. Thanks and over. I would like to get feedback on this.
Okay, so Isaac, please, any feedback on this?
Like from the person who asked this question, are you okay?
Isaac, please, are you okay?
Yes, I am. I got it.
Excellent. Okay.
Okay, please, Dr. Buko, please, would you like to add up?
Well, I think Dr. Obed has done justice to it.
Okay, Israel, if you're on the call, please, can you summarize this?
Yeah, I'm on the call. So let me translate the first question I made when you sent it to me. So, la personne a demandé à savoir si le patient vient à la pharmacie, il demande après les antibiotiques parce que voilà, il a fièvre. Donc, du coup, est-ce qu'il faut vendre l'antibiotique à son patient en tant que pharmacien, tu es à la pharmacie, quelqu'un vient et dit qu'il a la fièvre dû à une infection. La personne n'est même pas sûre. Et la personne a dit que c'est peut-être dû à l'infection parce que la personne dit qu'il a le corps chaud. Donc, la personne est en train juste de dire les trucs que lui-même il suppose, pas que la personne allait faire les analyses. Donc, la personne demande à toi, prescripteur, si c'est possible d'avoir l'antibiotique. Donc, la question, c'est de savoir, est-ce que en tant que prescripteur, qu'est-ce qu'il faut dire à cette personne? Donc, le docteur Obed avait dit, il faut d'abord convaincre le patient. D'accord? Il faut le convaincre, donner lui autre alternative. Il peut prendre paracétamol pour calmer sa fièvre. Ne pas donner directement l'antibiotique, non. Ne pas donner l'antibiotique. Donc, il faut l'expliquer également pourquoi ce n'est pas bien de prendre. Parce que si la personne ne comprend pas l'enjeu, et en tant que pharmacien, utilisez votre compétence pour convaincre la personne. Donc, voilà ce que la personne a, voilà ce que Dr Obed a dit. Pour terminer, il a également dit que voilà, vous pouvez lui dire également que c'est vrai que la pharmacie, c'est pour vendre des médicaments, pour faire bénéfice, mais que ce n'est pas juste dans le cadre de bénéfice, faire juste de l'argent, mais c'est également prendre soin de leur santé, parce que leur santé est plus importante que l'argent. Je sais que malheureusement, en tout cas, je ne sais pas dans votre cas, mais dans bon nombre de pharmacies, dans bon nombre de pharmacies, nous ne le faisons pas. Voilà. Le docteur va vouloir que le chiffre d'affaires augmente. La personne vient, il a un peu de fièvre, on sollicite, on lui donne. Mais le docteur nous dit, en fait, nous conseille vivement de ne pas le faire et voilà, il nous sollicite à encourager les gens à ne pas également vendre les antibiotiques liés juste à une augmentation de température. Voilà, merci beaucoup. Shalom.
Okay. Thank you very much, Israel. Please, do you have any more questions? If you don't, you can wrap up.
How many, how, um, are we going to end, at what time are we going to end up?
Well, if you don't have any more questions, we'll be wrapping up.
Ah, ok, let me, si on n'a plus d'autres questions, on va juste prendre sur la fin de notre dernière session et la fin pour aujourd'hui. Non, s'il n'y a plus d'autres questions, je pense que c'est la fin.
Okay.
Merci à tout le monde pour avoir participé. To open the mic, to camera, to have to take a
Pictures,
picture. Or is not necessary? Okay, all right. Donc, vous pouvez ouvrir votre caméra, nous allons prendre photo. The thing. Okay, people are asking since to get the certificate, so they want to know where is Susan? Susan is here.
Please, everything will be sent to our emails and
Right.
on the
On va vous
IPSF
envoyer tout le
platform.
lien d'émission pour remplir et puis ce sera envoyé par email. Que
And the
ici, donc,
IPSF
un email qui vous
platform.
sera envoyé. OK, sur les plateformes de l'IPSF. J'espère que tous vous êtes sur les plateformes de l'IPSF. Pour un prochain événement, on espère que vous allez venir en nombre. Merci d'être venu en nombre. Thank you, everyone. Thank you. We hope that for the next project, IPSA project, we will see you. Thank you, everyone. At the end of our sessions, so kindly you open your camera. You are about to take a so kindly open your camera. Mais nous allons prendre une photo de fin. Charles, are you going to take the picture?
Please, is it possible for you to take the picture from your side?
It is, but the picture. Okay, let me try. Aurélie, comment tu... Dis-moi, tu peux essayer de prendre la photo de fin?
So please,
Aurélie?
everyone, turn on your cameras for your pictures.
Aurélie,
And then, yes, please, when you take the pictures, you can post it on
tu
your
peux prendre la photo de fin?
your LinkedIn pages and tag
La
IPSF
photo.
AfRO
Oh,
and
oh,
what you learned
je ne
on
pourrais pas prendre
the
ça
AMR.
actuellement. Ça, je pourrais.
Pourquoi?
Je vais essayer voir.
Je vais essayer.
Je vais essayer voir.
Tu veux essayer?
Is my camera turning on?
Yeah, 1 second, please.
Are you seeing me?
Okay.
Visual, please, are you done taking the pictures?
Yeah, but someone take it because I use my phone to take the picture. So I don't know if Aurélie was trying to take it. Aurélie, tu as pu prendre?
Okay.
Oh non, non, je n'arrive pas.
Bon, je l'ai pris directement avec mon téléphone, mais normalement, il y a une ancienne, c'est avec le Zoom, avec le Meet, j'arrive à faire ça avec le Zoom, je sais pas. Ok, en tout cas, il y a les photos sur le téléphone. Donc, voilà. So let me take the last one. Okay, so all right, I'm done with the picture. Thank you all. Floor back to you. Shalom, if you have anything to say, I don't know.
Okay. So
Thank you for participation. It's so nice to see you guys.
Okay, so thank you all for joining us from the very first day of the AMR forum. And we hope that you learned one or two and that you would educate the people around you in your communities, your schools, your workplaces, and then also you would be people of change and you will try and then help fight this menace. Thank you to our speakers, Dr. Derek Buku and Dr. Obed Amponsam for providing us an insight onto this topic. And then I hope that everyone would continue to connect and network on the on our LinkedIn pages, and would also continuously follow IPSF AfRO program and participate in them. So please, when the pictures are sent, please post them on your social media platforms, your LinkedIn pages, your Instagram pages, and tag IPSF AfRO, and then tell us one or two things that you've learned from this session. Thank you so much. Suzanne, please, over to you. Okay. Okay. So I think that's all. Thank you all for joining the meeting. Please do have a great day. All the best.
Thank you. Shalom. Shalom. Bye. Bye all. Bye bye.
Yeah.